Did you tear your ACL and you're unsure what to do next, but you do have surgery planned? You got to listen to this video because we're going to go over the top 3 reasons why you need to be doing prehab. So my name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. So let's jump into the topic of what is prehab. All right, guys, so what is prehab? So prehab is the rehab before surgery. So it's a very important piece because if you've torn your ACL, what happens is normally it's a contact, non-contact injury. If you want to learn more about how to tear an ACL, comment below, we'll send you a link, or just check in the description below. We'll link all of our ACL videos. But you tear your ACL, then what happens is there's gonna be a gap before you have surgery. And that is very common because if you think about NBA players, they'll tear their ACL and you won't hear about anything about them for like 2, 3 weeks, 4 weeks, and then they'll say, oh, they had a successful surgery. And a lot of people ask us like, why don't they have surgery right away? Like for example, for an Achilles tendon tear, they'll tear their Achilles and then they'll have surgery within a week because a tendon tear is different from a ligament tear. A tendon, we gotta suture it, you gotta go as soon as possible. Ligament, you could wait a little bit longer. But for NBA players or any professional athletes, they want to maximize their time and go back to playing basketball as soon as possible. So that time before surgery is minimized as much and safely as possible. But for the normal athlete, it takes a little longer, and I'll explain the process. So for the normal athlete, you tear your ACL, then you got to figure out if you tore your ACL or not. So you need to get an MRI. We could also do manual tests as well, but an MRI always has to confirm it. Then from there, you're going to see your orthopedist, and the orthopedist is going to go over the results with you and then say, hey, you most likely need to have surgery, especially if you have instability in your knee. From there, they schedule a date. So this whole process, based on insurance, based on other little loopholes, might take anywhere between 2 to 3 months or even longer. However, that's not always a bad thing because during that time, it's going to allow you to prehab and set you up for success for improved and easy recovery after surgery. And we're going to go over the top 3 reasons why you need to be doing and focusing on prehab. All right, guys, the number 1 reason and the most important reason is it improves outcomes. So we've seen time and time and again, we're seeing clients on our own, the people that seek out prehab and that see us for prehab or go somewhere else for prehab or just do prehab in general, have an easier recovery after surgery. And the reason why is because they're going to focus on a couple things. The main goal before surgery is to calm the knee down. When you tear your ACL, you're probably gonna have some swelling because sometimes you have a bone bruise, other associated structures, but we wanna minimize that swelling because if you have swelling going into surgery, what's gonna happen? You're gonna have even more swelling and the knee's not in that calm state. So just imagine there's a lot of swelling in the knee, then you go do surgery, which is gonna cause even more swelling, and our whole body just doesn't know how to react. It's just too much swelling and the knee hasn't been comfortable since the initial injury. So we want the knee to be calmed down, no swelling, then they could go into surgery. And that's gonna allow us to have less swelling after surgery because if we have more swelling, that's gonna affect our range of motion, affect our ability to walk, affect our ability to activate the quads. So that's one of the partial reasons why we need to get the knee to calm down with swelling. So we calm down with swelling, which is gonna allow easier recovery afterwards. Number 2, we wanna get some of that strength back. So the biggest thing is strength and range of motion. So once the swelling's down, we need to make sure we have mobility because if we can't get our knee straight before surgery or get our knee bending to 120 degrees, it's really going to affect us after surgery because we're going to have some built up scar tissue that you've already had before surgery, and you're going to maybe even have some after surgery as well. So working on that range of motion is critical and it allows us set up for success to get that range of motion back after surgery. And in regards to muscles, we're really just trying to minimize atrophy. Because you've noticed if you tear your ACL, your quad's gonna get really weak, your hamstrings, calves, your whole leg's gonna get really weak. And we wanna make sure we minimize that weakness because after surgery, guess what? Your muscles are gonna get weaker as well. So we're already gonna go in weak and then we're gonna get weaker after surgery. So we wanna get some strength or at least maintain some strength. That way we don't go as weak into surgery and our recovery is a little bit easier at that point. Reason number 2 is that it improves your confidence, just clarity too, because you have so many questions unanswered when you tear your ACL. Hey, what's gonna happen? What do I need to do for surgery? What graft do I use? So all these questions are huge for us to just get answers to. And that's what, you want to do during this prehab time. Find out what we need to do for the surgery, what graft is best for you. We have a great YouTube video talking about graft choices. Check the description below. But graft choices is huge. Like, do you get a quad tendon, patellar tendon, or do you get a cadaver? Those are all questions the surgeon's going to ask you, but then you have to decide. So those are the questions you need to be answering during that prehab stage. Also, you want to find out, will I be able to walk after surgery? When can I go back to work? When can I go back to playing basketball? So all these questions are answered during your prehab stage, because you'll be able to work with the physical therapist, or if you're doing research online, instead of just, hey, I'm just gonna play it out, let it just go after surgery. You want to have all these answers, because surgery is a big thing, and you want to know some of the answers that you can get, because there's a lot of unknowns. But if we can minimize those unknowns, you'll have decreased anxiety, you have a clearer mind going into surgery. Because if you're already nervous, because it's already a surgical procedure, but you'll be even more nervous when you don't have these answers, like, hey, what am I supposed to be doing after surgery right away? And those are the things that you want to have and kind of know about before going into that surgery. And that's during that prehab stage, is when you try to get all your questions answered as much as possible through a surgeon, through a physical therapist, or finding a support group as well. The third and final reason, which actually is one of the most important reasons tied up with number one, is finding a physical therapist for you. So finding a physical therapist will answer all your questions and set you up for success for surgery during that prehab stage. But it has to be the right physical therapist. So find a therapist that is aligned with your goals and with your vision of going back to sports, if you want to get back to playing basketball or anything like that. Because finding the right physical therapist, you would, one, build that rapport with them. So finding out, okay, this is what I want to do. You sit down. For example, with our athletes, every time we come in, they could tear their ACL, we sit down with them. We tell them, like, hey, these are your goals for prehab, and these are your goals for after surgery. So we set you up all through that pathway, so you know exactly what to do. And we go over how we talked about the calm knee, getting that range of motion, all those things that we need to do to set you up for success after surgery. And you also want to start talking about those goals that you have for yourself. Like, hey, I do want to get back to playing basketball. Or you're like, hey, you know what? I don't want to get back to playing basketball. I just want to go back to running, lifting weights. All this you want to have conversations with before surgery. And that's why you find this PT before surgery, to set you up. After surgery, everything's already set, as opposed to us wasting time after surgery during this whole conversation. Might as well do it now to maximize our time. And another big reason within this is, once you find a PT, it sets up finding appointments easier, to be honest. Because a lot of times we see clients that are unable to see a PT for 3 weeks, 4 weeks, or that just delays your rehab. So you want to see someone before, so you could be already set up with appointments right after surgery and know what steps to take after surgery. All right, guys, hopefully I convinced you guys to do prehab. We went over the top 3 reasons. 1 is improving your outcomes. 2, just kind of answering all your questions, getting a clear mind. And 3, find a PT, get that PT going. That way you build that relation, build those goals. The main thing, like I mentioned, guys, before surgery, you want to do some prehab. You can't just be laying down, not putting any weight. That's just going to get your knee weaker, stiffer, and just not have great outcomes after surgery. So the more prehab you do, the better the outcomes. But you got to do the right prehab. That's why finding the right therapist. So if you guys have any questions regarding ACL rehab, or if you just had surgery and you want to get some questions answered, send us a message, comment below. We'll try and make a video on your questions. Or if you want to work with us online or in Southern California area, also send us an email. But we are the Basketball Doctors. Let's ball for life.